Good afternoon. We are here today to announce the results of a 2-week nationwide law enforcement action across 32 federal districts and against 193 defendants for their roles in healthcare fraud schemes. In addition to the charges and arrests being announced today, we are also announcing that we have seized over $230 million in cash, luxury vehicles, gold, and other assets in connection with these cases. The Justice Department has been clear that we will bring to justice criminals who defraud Americans and steal from taxpayer-funded programs. We have a particularly aggressive approach to combating healthcare fraud schemes that put people in danger for the sake of profits. Our efforts to combat healthcare fraud are focused on 4 fundamental principles. First, protecting vulnerable patients. Second, defending taxpayer-funded programs. Third, ensuring full accountability by prosecuting the perpetrators of these crimes and seizing their criminal proceeds. And fourth, using data analytics to keep pace with constantly evolving fraud schemes. First, we are focused on protecting vulnerable patients. In the Southern District of Florida, we charged 3 owners of a pharmaceutical wholesale company in a $90 million wire fraud conspiracy to distribute adulterated and misbranded HIV drugs to pharmacies and patients throughout the country. We allege that the defendants purchased these drugs at steep discounts from black market suppliers and then resold them to pharmacies with falsified documentation designed to conceal the true source of the medication. As a result, patients at times received bottles labeled as their prescription medication with entirely different drugs inside. One patient passed out and was unconscious for 24 hours after taking an antipsychotic that he believed was his prescribed HIV medication. In addition to protecting patients, our approach is guided by our commitment to protecting the taxpayer-funded programs they rely on. That is why in the District of Arizona, we charged 2 wound care company owners and 2 nurse practitioners in a $900 million Medicare fraud conspiracy targeting elderly patients. In that case, we allege that the defendants caused unnecessary, highly expensive wound grafts to be applied to elderly Medicare patients, many of whom were terminally ill in hospice care. This was done without coordination with the patient's treating physicians and without proper treatment for infection. Medicare paid the defendants more than $1 million per patient for these unnecessary grafts. The third pillar of our approach is to ensure full accountability for these crimes, not just by charging and arresting those responsible, but also by seizing assets we allege have been stolen from taxpayers. That's why in the case I just highlighted, we not only charged 4 defendants, but we also seized tens of millions of dollars in assets, including 4 luxury vehicles, gold, and bank accounts, totaling more than $50 million. The fourth pillar of our strategy is ensuring that we keep pace with constantly evolving health care fraud schemes. That includes addressing the rise of schemes that exploit telemedicine technology, specifically as it relates to Adderall and other stimulants. Utilizing proactive data analytics, we identified misuse of telemedicine as a possible source of an increase in prescriptions for stimulants. Thereafter, we worked with law enforcement officers to identify potential schemes. Our investigation led us to a digital healthcare company called Done. Earlier this month, we charged and arrested the former CEO and the clinical president of Done for their respective roles in a $100 million scheme to defraud taxpayers and provide easy access to Adderall and other stimulants for no legitimate medical purpose. Today, we are also announcing that we charged an additional 5 defendants for their alleged involvement in that scheme to distribute more than $40 million in medically unnecessary pills. One of the defendants, who is among the company's largest prescribers, was indicted for rubber stamping prescriptions without any medical review. As alleged, the defendant also signed prescriptions for patients who were deceased. I want to be clear. It does not matter if you are a trafficker in a drug cartel or a corporate executive or medical professional employed by a healthcare company. If you profit from the unlawful distribution of controlled substances, you will be held accountable. The cases I outlined represent only a fraction of the broader actions that we are announcing today. Earlier this week, I visited the U.S. Attorney's Office for the Middle District of Tennessee in Nashville. I spoke with prosecutors who have investigated and charged 2 defendants with perpetrating a fraud scheme involving millions of dollars in fraudulent Medicare claims and kickback payments. The defendants were arrested on Monday. This 2-week period will be matched with sustained efforts by the Department's Criminal Division in partnership with our U.S. Attorney's offices nationwide to zero in on healthcare fraud schemes. I want to thank the dozens of U.S. Attorney's offices that investigated and prosecuted cases in their districts, the FBI, the DEA, and our partners from across the federal government. And I especially want to recognize the Criminal Division's Healthcare Fraud Unit for their leadership and their excellent work. We do this work because we know that healthcare fraud is not a victimless crime. We will continue to disrupt schemes that target patients at their most vulnerable. We will continue to defend taxpayer-funded programs from fraud. We will continue to bring justice to the perpetrators responsible for these schemes. We will continue to seize the funds they stole from taxpayers. And as healthcare fraud schemes continue to evolve, so will the Justice Department's investigative and prosecutorial strategies. Our messages to those seeking to exploit patients and defraud government program is clear. You cannot hide your crimes. We will find you, and we will hold you accountable. Before I close, I want to address today's Supreme Court order in Moyle versus United States. The Justice Department filed this lawsuit because EMTALA guarantees essential emergency care to all Americans, no matter which state they live in. If a patient comes into an emergency room with a medical emergency seriously jeopardizing the patient's life or health, EMTALA requires hospitals to offer the treatment necessary to stabilize that patient, including pregnancy termination, if that is the treatment required to save a woman's life or prevent serious harm to her health. Today's order means that while we continue to litigate our case, women in Idaho will once again have access to the emergency care guaranteed to them under federal law. The Justice Department will continue to use every available tool to ensure that women in every state have access to that care. And now I'm going to ask HHS Deputy Secretary Palm if she would like to say a word. Here you go.
Thank you, sir. Good afternoon, everybody. I am Andrea Palm. I have the privilege of serving as the Deputy Secretary at the U.S. Department of Health and Human Services. I want to thank Attorney General Garland for hosting us and for our partners all across the law enforcement ecosystem here at the federal government for the work that has brought us to this moment, and really echo the Attorney General's comments about our commitment to really bring justice to the criminals who are defrauding U.S. government-funded healthcare programs. The work really is critical to our mission at HHS and the millions of Americans who rely on HHS-funded healthcare programs are counting on us to do this work together and vigorously pursue anyone who commits fraud against our healthcare programs. But as you can see from this action today, that it really does take all of us to be successful in this space. And healthcare fraud really is a complex and, as the Attorney General said, evolving threat. And the negative impact to healthcare is clear. The American people trust HHS really to ensure that federal healthcare programs provide high-quality care. And the bad actors that are stealing from these programs are compromising the quality of that care. And in addition to the dollars that they're stealing, they are putting, as some of the examples that the Attorney General used, are really putting patients at risk and undermining quality. So the actions announced today address fraudulent activities targeting critical HHS programs, including Medicare and Medicaid, along with other HHS-funded work around substance abuse treatment and other medical care. As an additional example, today's action includes allegations about schemes targeting behavioral health treatment centers that served American Indian and Alaska Native families and their communities in Arizona. The schemes they perpetrated specifically targeted vulnerable Native Americans by establishing phony sober living homes that claimed to provide addiction treatment and other support. However, these homes really were just false fronts, posing significant risk, again, to the quality of care that those patients needed and deserved in that moment of vulnerability, while all the while those false fronts were billing our healthcare system for millions of dollars for services that were never provided. These and the examples the Attorney General highlighted and dozens of others have been stopped through the actions that we are taking. Nearly 200 individuals have been or will be charged, and we have recovered nearly $150 million from Arizona and more than $3 billion across all of these enforcement actions. This is not the first time that we have taken action like this, and it certainly will not be the last. Those who steal from the programs are stealing from the American families who rely on our healthcare programs, again, putting patients at risk. We want the American people to know that we take this very seriously and see it as our responsibility at HHS to use taxpayer dollars wisely and to promote the health and well-being of all Americans, and that we, as again the Attorney General said, will not stop until we bring all those who are attempting to defraud the federal government to justice. I also want to echo the Attorney General's thanks to all those who made today's announcement possible. I certainly would be remiss if I did not shout out the HHS Inspector General's office and our team there, who have worked tirelessly and continue to work tirelessly in partnership with us at HHS to do the work we need to do to keep our programs safe. So with that, I'm going to turn it over to our Inspector General to provide a few remarks. Thank you.
Thank you, Deputy Secretary Palm, and thank you, Attorney General Garland, for inviting me to be part of this announcement today. I am Christy Grimm. I am the Inspector General for the United States Department of Health and Human Services. I am incredibly proud to represent OIG's phenomenal criminal investigative agents, digital investigators, and data scientists. Their tenacity and tireless work produce exceptional results day in and day out for Americans. Law enforcement actions like the one we're announcing today are only possible because of the strong partnerships we have with HHS and our law enforcement partners. The invaluable work of the Medicaid fraud control units deserves recognition. The investigators in these units are deep experts in complex state Medicaid programs and Medicaid fraud schemes. Today's national enforcement action underscores the government's resolve to shut down healthcare fraud wherever it appears and in whatever form it takes. The government is using sophisticated data analytics to rewrite the fraud-fighting playbook. With the power of data, analytics, and technology, we can detect fraud and stop it sooner. And together with our public and private partners, we decrease the amount of money going into the hands of wrongdoers. The enforcement action being announced today includes allegations that providers were involved in a scheme with a startup telehealth company that purported to diagnose and treat ADHD and used deceptive advertising on social media to target prospective patients. Telehealth and other technologies hold great promise to improve healthcare, but in the wrong hands and used for the wrong purposes, the consequences can be devastating. As alleged, this scheme resulted in many disturbing harms, including patients being prescribed Adderall and other stimulants for no legitimate medical purpose. We're also cracking down on schemes that trick Medicare enrollees into obtaining expensive genetic testing without regard for medical necessity. Again, I commend the exceptional work of the dedicated professionals in my office and our partners in this successful enforcement action. I'll now turn the microphone over to DEA Principal Deputy Administrator George Papadopoulos.
Thank you, Attorney General Garland. We appreciate the opportunity to be here. Good afternoon. I'm George Papadopoulos, DEA's Principal Deputy Administrator. Every day, the DEA works tirelessly across the country and around the world to save lives by protecting the public from dangerous and deadly drug threats. Whether the threats are from the drug cartels flooding the United States with synthetic drugs like fentanyl, the deadliest drug threat we've ever faced, or from telemedicine providers and practitioners who unnecessarily peddle addictive controlled substances for profit. In March 2020, in response to the COVID-19 pandemic, the federal government authorized the broader use of telemedicine services to allow patients access to needed health services and medications without requiring an in-person visit. While this ease of access to healthcare services expanded availability and convenience, individuals like Ruthia He, the founder and CEO of Dunn Global, and David Brody, the clinical president of Dunn Health, exploited the expansion for profit. Telemedicine plays an important role by ensuring access and continuity of needed medical care to all Americans. However, the cases we are discussing today are a clear example of what happens when individuals and corporations prioritize profits over patient care. As alleged in the indictment, the defendants provided easy access to controlled substances like Adderall and other highly addictive medications through monthly subscriptions and in many cases for no legitimate medical purpose. One practitioner alone prescribed 1.5 million pills of Adderall and other stimulants to patients across the country. The defendants put profits over patients, made millions of dollars in the process, and likely exacerbated prescription stimulant shortages like those identified by the FDA in 2022. Our message is clear. The DEA, along with our law enforcement partners, will shut down pill mills, whether they are in doctors' offices or in online telemedicine platforms. We will continue to hold everyone accountable, including company executives, that use telemedicine platforms to put profits over patient safety, because addictive medications require a legitimate prescription, not a monthly subscription. I thank the men and women of the DEA who worked on these important cases and our law enforcement partners and prosecutors for their assistance with our investigations. I'll now turn it over to FBI Executive Assistant Director Tim Langen.
Good afternoon. I'm the Executive Assistant Director over the FBI's Criminal Cyber and Response Services branch. I want to echo what the Attorney General, Garland, and our speakers have said. I want to thank everyone who made this takedown possible. From the FBI special agents, analysts, forensic accountants, and professional staff to the agents of HHS, OIG, to the trial attorneys from the Department of Justice Fraud Section who make up our healthcare fraud strike forces around the country. The dedication and tenacity of everyone involved on these teams are what produces great results, as we've discussed. These investigations and arrests embody the idea of strong partnerships and would not have been possible without the robust collaboration. FBI headquarters and 25 of our field offices across the country took part in this initiative. From reducing access to pill fueling addictions to the medical professionals who violated their oaths and lined their pockets and using our healthcare system as their own personal ATM. I want you to listen to today's announcement loud and clear. All of us here and the countless law enforcement partners at all levels, state, local, and federal, will not let this kind of healthcare fraud continue to happen. As Americans, we rely on our health systems to be fair and our health records to be accurate. When unscrupulous perpetrators fake diagnoses in our medical records, bill us for services that we never received or were not medically necessary, they not only steal taxpayer dollars, but many times are harming vulnerable patients. I want to talk about some of the numbers for a moment. 193 defendants were charged across 25 field offices. 76 of them are licensed medical professionals, individuals who intentionally deceived the healthcare system to receive unlawful benefits or payments and betrayed the trust of their patients, ultimately billing nearly $2.75 billion in illegitimate claims. think about the impact that that has on our healthcare system. And it's not just happening in one area. We're seeing it all over the country. We've seen vulnerable patients trying to overcome addiction and seek treatment at sober homes, but our investigations revealed that these patients were exploited. Those accused today set up sham sober homes and fed people with drugs and alcohol while billing our healthcare systems for millions of dollars for services not rendered. Additionally, criminal organizations use COVID-19 pandemic funds to line their pockets and prey upon the American public and the programs designed to protect us. Those charged employed fake COVID-19 tests, fake test results, billed for additional unnecessary testing, and falsely obtained our personal health information for nefarious purposes. Whether it be exploiting wound care among hospice patients, paying bribes in exchange for ordering of medically unnecessary cardio testing, manipulating the prescription drug process, our agents and partners will continue to find them and hold them accountable, as evidenced by today's announcement. The pervasiveness of the healthcare fraud threat and the boldness of those willing to take advantage of our system is evidenced by the diversity of the fraud schemes announced today and the estimated loss amounts in the billions of dollars. As our population ages, healthcare expenditures will only continue to increase, as will the number of cases we will continue to investigate. And the FBI will not stop in our pursuit of bringing these perpetrators to justice. Before I close today, I'd like to thank the public and everyone who took time to report the fraud, waste, and abuse that they found, they witnessed, or they experienced. Your reporting was essential to the overall outcome of today's investigative results. Working together, we can stop healthcare fraud and keep our nation's healthcare system strong for those who need it. Remember, you can always report suspected healthcare fraud to your local FBI office or 1-800-FBI-TIPS. Now I'll turn things over to my colleague from HSI, Deputy Executive Assistant Director Patrick McGowan.
Good afternoon, and thank you very much to Attorney General Garland. My name is Patrick McElwain, and I'm the Deputy Director for HSI. In 1982, President Ronald Reagan formed the Organized Crime Drug Enforcement Task Force, an elite first-of-its-kind operation. For 42 years, OCDETF has been made up of agents, investigators, and law enforcement officers from federal, state, and local governments. They've led many of our government's efforts to identify, disrupt, and dismantle major transnational criminal organizations that prey on vulnerable Americans and harm our communities. Special agents from Homeland Security Investigations have proudly helped lead OCDETF. HSI and its unique authorities, coupled with expertise in money laundering, cybercrime, and border enforcement, along with HSI's vast international footprint, have helped OCDETF bring criminals to justice. The charges brought to date against 7 executives of Dunn Global, Inc. and its affiliated medical staff is a testament to the skills HSI and our law enforcement colleagues bring to OCDETF and the expertise HSI brought to the task force's first ever case targeting a telehealth company. The company advertised diagnoses and stimulant medication prescriptions for ADHD via the internet, and current and former employees told reporters that officials put pressure on clinicians to prescribe stimulants that weren't medically necessary. Also, the diagnosis appointments the company offered were simply a sham and were insufficient to accurately diagnose ADHD. HSI looked into the company, its leadership, and the doctors and nurse practitioners who prescribed the medications and used HSI's authorities to access critical investigative material. We discovered notes, records, and other communications from one of Dunn Global's most prolific providers, a nurse practitioner in Florida who prescribed more than 1.5 million pills, including Adderall and other stimulants. Because of our expertise in the cyber realm, investigators were able to examine seized electronic devices almost immediately. HSI, in conjunction with our law enforcement partners, made the arrest, and the CEO was charged 2 weeks ago. I'm extraordinarily proud of all the federal law enforcement agents who stopped these individuals from hurting even more people. These agents made considerable sacrifices, working tirelessly to pursue justice and bring this criminal enterprise's activity to light. Thanks to their exceptional work today, the United States is sending a clear message to anyone who seeks to profit from addiction by illegally distributing controlled substance over the internet or otherwise. HSI, the Department of Justice, and our partners across the federal government are holding providers and prescribers accountable for preying on their patients. With that, I will turn it back over to Attorney General Garland.
With that, I will turn it over to Sochi to ask questions.
Alana.
Hi.
I have two questions. First, what is the reason for these kind of coordinated crackdowns? Is deterrence the goal? And I have an off-topic question too, which
Let's
is...
do one at a time.
Okay.
With respect to that question, one of the three major priorities of the Justice Department are keeping our communities safe. With respect to healthcare fraud, this actually has two parts. One is keeping individuals medically, physically safe, which is reflected by some of the cases that I talked about. And the other part is keeping our healthcare system economically secure, which leads to the safety of Americans. And that is what we're looking for with respect to deterrence. We're also, so that people know that what happens to you if you commit this kind of crime, what kind of sentence you're going to end up with, and that we're going to find you. The data analytics that we employ are also intended to cut short on these schemes before they are able to defraud the healthcare system. And the third part, which is to seize the assets and return it to the Treasury. So that's the reason for these. This is just the results of one 2-week program. We are not going away. It's going to be continued over and over again.
Thank you. And I'm also wondering if you can explain the Justice Department's reasoning for resolving the Julian Assange case now instead of continuing to fight for his extradition.
Yeah, so we don't discuss internal deliberations of the department. We don't discuss deliberations with defense counsel with respect to plea bargains, and we certainly don't know of internal deliberations by the defendant's counsel. The Justice Department reaches resolution in plea matters when the Justice Department believes it can reach a resolution that serves the best interests of the United States. That's what we've done here.
Over the weekend, there were some clashes in front of a synagogue in Los Angeles, and that potentially could have prevented access for someone getting into a house of worship. Is the department looking into this? Are you looking into it under the FACE Act or some other avenue?
Yeah, so let me say what I can say now about that specific situation. The U.S. Attorney's Office for the Central District of California, which is Los Angeles, the Justice Department's Civil Rights Division and Main Justice, and the FBI have been, and as we speak, are collecting evidence on that matter. Let me say more generally, I should report that over the last few months, the Justice Department has brought charges, obtained plea agreements, and obtained sentences for more than 30 defendants for criminal acts motivated by anti-Semitic hate. And I want to say that whether these acts are criminal or not, anti-Semitic hate is morally odious. And in this kind of society, we just cannot tolerate. Now, let me say more generally on this subject. This is a matter that matters to me personally. It matters to me personally not only because, as many of you know, my personal history of having relatives who escaped the Holocaust and some who did not, but it also matters to me personally because I'm part of a contemporary community that has a widespread and well-founded fear of anti-Semitic hatred. So let me say both to the Jewish community and to those who would do it harm, the Justice Department will not tolerate criminal acts motivated by anti-Semitic hate. We will find those people who are perpetrators, and we will hold them accountable. And let me say, and let me promise to the Jewish community that this Justice Department will do everything within its power, working with federal partners and state and local partners to secure the community's safety. And as Attorney General, I will do everything in my power to do that.
Next question, Andrew. Start with my on-topic question. What is the scale of this operation? 193 defendants and $2.75 billion. What does that say about the extent of healthcare fraud in the United States? And are there things that you can do from a policy perspective to limit this kind of thing?
Well, on the first question, this is only a 2-week snapshot of what we've been able to do in 2 weeks. So this understates the scale, which is much larger, and which several inspector generals have reported in general on the scope of the problem. I'm going to turn to the Deputy Secretary of HHS to talk about what can be done from a preventive point of view.
Thanks for the question. I guess I would say a couple things. One, you sort of need to put in context the dollars that are in the healthcare system, right? We are 17% of GDP. That is going to grow. And so we are a target-rich environment, right? And so the ways in which we think about our responsibility to ensure that the taxpayer dollars that are entrusted to us are used well includes an evolving, I think the Inspector General, the Attorney General have alluded to things like data analytics, right? This space is evolving, it's getting more complicated. The ways in which we stop dollars from going out the door through the use of data analytics is a critical part of how we are thinking about the future. We are certainly employing those tactics now. We think investments in additional technology, thinking about how we responsibly use AI, there's opportunities there in this space. But we also need to make sure, and you can see it in the President's FY25 budget, the ways in which we are investing in our Inspector General's office to help make sure that they have tools that they need to do this work in partnership with us. Again, that partnership with CMS, their Center for Program Integrity, and that work with our Inspector General to make sure that we are sharing information, using all our analytic tools, again, to get to a place where we're stopping dollars from going out the door and not having to chase them after we've been billed and actually put that money out. But we think that the use of technology and the ways in which we are smarter and are agile to keep up with the evolving threat landscape in this space is really, really important to our future efforts.
Off-topic question?
Yeah, go ahead.
Prosecutors working with special counsel Jack Smith have said in court that a trial for former President Trump this fall would not violate the Justice Department's 90-day rule around elections. Would you, as the Attorney General, be comfortable with putting Trump as the Republican nominee on trial?
Look, I'm not going to talk about the pending case other than to say that the prosecutors brought both of the cases almost a year ago. They asked for trials in December of last year and January of this year. And other than that, I'm not going to talk about a case that's pending.
Last question, Evan.
Attorney General, as you may have heard, there's a debate tonight in Atlanta between President Biden and the former president. And we expect, given the last few days, that we're going to hear a lot about political persecutions and prosecutions of the former president. What can you tell the public about the efforts that you've made that you believe would show that there hasn't been a political persecution of the former president?
The idea that politics infects our prosecutions, nothing could be further from the truth. We have one rule, we follow the facts, and we follow the law, and we make the appropriate decisions. That's what the special counsels have done, and that's what the Justice Department has always done.
Thank you, everyone.
Thanks, everybody.